It's very nice to have you here.
Yeah, me too. I'm so happy and nice to see you.
Thank you, Hannah. And I think, as you rightly know, that we are having this surgery and
Yes,
PPV that's planned for tomorrow.
exactly.
If you have any questions, any doubt, any fear, you can share it with
Yeah,
me.
sure. Which vaginoplasty is the best for the
It's a
trans
very
people?
common question, Hannah,
Yeah.
but as a surgeon, I always say there's nothing like best and worst.
Mm-hmm.
All the surgeons try to deliver their best possible vaginoplasties
Yeah,
with the art and skills and the knowledge they have.
exactly.
In my hand, I do a lot of PPV.
Yeah.
So my learning curve and my experience and my team's experience is more into the PPV. I can share the benefit of PPV
Yeah.
is it's as near possible as cis vagina,
Exactly.
or it is as cis vagina as possible, or one can create, at least in my team's experience.
Yeah.
The lubrication, the aesthetic, the need for dilators are very much favorable with the for the patient by this technique. By saying this, many surgeons are doing the penile inversion
Yeah.
with all the modification,
Exactly.
the intestinal vaginoplasties with all the modifications. The bottom line is satisfaction of the patient.
Yeah.
So that is it.
What will be the complications after the surgery?
Hana, it's a very long surgery. It's a very complex surgery. So the complication of any long surgery, like of anesthesia, the DVT, the nerve injuries, and the nerve praxias
Yeah.
are there. The lung-related complications sometimes are there. At the same time, the laparoscopic-related complication of injuring the internal organ are always there, and the vaginoplasty-related complication like injuring your prostate, urethra, rectum,
Yeah.
when we are creating a cavity, it's always there. But as you select your team, and if the team has gained that experience, all these complications can be minimized. Very rarely we are seeing now this complication, that too mainly in the patient who are smokers,
Yes.
those who are more obese,
Yeah.
or when we are doing redo vaginoplasties.
Okay.
In a primary vaginoplasties, yes, of course, the complications are there to enlist, but the relations or the rate of that are minimum.
What would be the pain scale after the surgery?
So let me tell you that Hana is a medical student and she is doing her research in Spain right now. And she has been a wonderful patient and she knows a lot about this technique. The pain scale, Hana, would be approximately 2 to 4 in initial days,
Wow.
and which goes on a decreasing trend. Now, if we encounter a lot of bleeding, then of course the pain may go on a higher side. The most common or a difficult situation would be during the dilation of initial 3-4 months, when my patient passes dilated through the levator ani muscle. That hitting of the muscle is the most crucial and the most painful event.
Yeah.
So if you try to relax your pelvic floor muscles and dilate, there is a very, very minimum pain or a discomfort, I would say.
Wow.
But that's a technique which we make our patient learn, and that's a surgical technique by which we can cut the muscle so that the post-operative pain is minimum. So to summarize, the pain scale would be 2 to 4.
How many years they need to do dilation?
I understand. So how many years and how frequent? There's
Exactly.
the common question again.
Exactly.
After the vaginoplasty. Now it all depends on the healing of the vagina. It all depends on the width and the depth of vagina being given or being offered to the patient. And at the same time, how frequently or how early they can start the sexual intercourse. Now, the sexual intercourse is the best dilation which is possible.
Yeah.
So, in my theory or in my experience, up to 3 months, 2 or 3 times in a day for 10 minutes dilation is required. And if that is being passed very easily, then we can go for a bigger and a deeper dilators. up to 3 months to 6 months, body tries to heal and
Yeah.
contract.
Yeah.
If initial 3 to 6 months are being taken very lightly, the cavity can collapse from the width and from the depth.
Yeah.
So that is very much crucial. That's very much patient dependent, but up to 6 months or 3 to 6 months is ideal. And if my patients are doing the dilation comfortably with their accepted diameter and depth, then the sexual intercourse can take care of or take replace the dilated process.
After how many months we could start sexual interaction?
Intercourse?
Yes.
Uh, Hannah, I would say 3 months.
3 months.
3 months, because we have some patients having starting the intercourse very early after the procedure, but then they lead to complications like the
Yes.
gapping of the labias and everything, and we don't want that.
Exactly.
Uh, Apart from that, also the peritoneum secretes lots of epithelial cells
Cells.
initially.
Yeah.
So you are going to take at least 3 months to heal from this event. Now, understand it's one of the most complex surgery because we are creating something in the space which was not there. So also the body will try to heal and adjust with this organ.
Yeah.
So that much amount of time is required from the body.
Okay. The main aim of any trans woman is to look like a girl or a woman.
I understand
completely.
that. I do
Yeah.
understand that, Hannah.
Yeah.
And exactly any organ will have two kind of importance. One is a functional and one is a aesthetic.
Exactly.
And we want to deliver a organ in toto which functions as vagina and
Yes.
which looks as vagina.
Yeah.
The beauty of PPV that we use peritoneum for the lining so that we have all the extra tissue of scrotum and a penile shaft to be used for the aesthesis.
Yeah.
Now, I won't commit that we make exactly looking cis vagina, but we do have patients coming back to us that they have undergone the sexual intercourse or they have undergone some of the hair removal technique, and no one could say that it's a reconstructed vagina.
Exactly.
And that itself is a very good feeling or feedback to us that we could make a vagina and someone could not just identify it.
That's amazing.
So even if we keep that as a goal, we are there.
Yeah.
By saying this, all the natural crevices which God has created, we have our limitations with that because we deal with a reconstruction where we want to give the aesthesis, but then there's a vasculature problem,
Yeah.
the necrosis and everything.
Exactly.
But we are trying to be there or achieve that goal.
Yeah, and I'm so thankful to you because before going to the surgery, the way you explain the process, that's amazing.
Thank you.
And even I'm a medical student, I understood very well, but the way you were explaining,
Thank you,
the
Anna.
people will understand so easily
you.
the process.
Thank you. And there is a whole aim of such kind of documentary or videos that we want to educate our people.
Yeah.
We want to educate the community that, of course, it's a complex surgery, but India has full potential to cater this kind of surgeries.
Yeah.
People are coming all across the globe to India for these surgeries. And definitely we are here to help you out. And we believe the whole team is passionate about the gender care. And there's the beauty of this team.
Yeah, I'm proud to you, and also I'm proud to our India because many other countries they're not doing this because
Yes.
we are super advanced. Like the countries like so-called so advanced,
Yeah, I know.
still they are not doing the whole version.
Because and even if they are doing this, there's a long waiting period.
Yes,
The good part of India is we can innovate things.
exactly.
We can innovate things.
Yeah.
There is no hierarchy that this system has been set and everyone has to follow this system.
Yeah. Yeah.
Now there's a positive negative of this, but if we can innovate something which has not been done in the world, we can gather 4 surgeons working together for 8 to 12 hours
Yeah.
and definitely that goes for the patient's benefit,
Yeah.
because every surgeon has their own perception of what he or she can deliver best to the patient,
Yeah.
and everything goes to the patient.
Yeah.
So there's the beauty of India, and of course the kind of hand holding we do,
Yeah.
the kind of care we do, the kind of post-op management we do,
Yeah.
it's not only here, everywhere in India.
Yeah.
So that's the beauty of Indian surgeons.
Yeah, actually, I gone through some articles on PPV. Very few. I can count on my fingers, and that's two from India. Then I was like, wow.
Yeah,
One from Russia, another from Thailand. There are only 5 articles on
that's right.
PPV. Wow,
That's
that's amazing.
Thank you, Hannah.
Thank
Thank
you
you.
so much.